Morning, Doc.
Good morning.
Welcome to the show. Thank you so much for taking out time, and it's always a pleasure to have so many different conversations with you. Always, most of the time, the conversation is with respect to the various cases that you are handling and how the diet we're gonna go about with. And I'm looking forward to have a conversation with respect to how your day is usually. By and large, we're gonna talk about the overall healthcare status of our population. We're going to deep dive into something more into the lines of heart health of our population and try and see how best we can add some value to the people watching this. And before we get started, Doc, how have you been?
I'm really good. And actually, thank you for helping us with all my patients and their diet problems.
Absolute pleasure, Doc. Absolute pleasure, man. I think when we started Pango, you were very clear that only if everyone in the healthcare industry comes together, it's only then we can really go out there and make an impact, because we know what's the current healthcare status of our country, right? And I think that's where I would, before we even get to that kind of conversation, what's your usually day like? How was your day today? What's the day looking so far? What's the day gonna look like today?
So far, it's been good. So my day usually starts at about 7 in the morning, right around the time my daughter goes to school. And then I leave for work at around 8 o'clock in the morning. And it takes about 1.5 hours to reach Mumbai Central. So by 10 o'clock at least, I'm at my work. And usually have some patients to see in the OPD. And then we have some surgical cases in the afternoon and evening as well. So I try to finish everything by about 9 p.m. and get back home.
Okay, and then again, it takes you again an hour and a half to reach back home.
During that time, it takes about 50 minutes.
I remember last week when I was trying to call you and fix up the schedule for this conversation, and I think your assistant, what's her name?
Yeah, too many assistants.
So she answered and she said that if it's urgent, let me know. And I remember you were operating someone, and I think you called me after 5 hours. Right, you called me after 5 hours. How long does a surgery take usually?
So it takes about 6 to 7 hours a surgery for a bypass surgery or a valve surgery, whatever we do. So major surgeries take about 6 to 7 hours.
And that's at a stretch, no break. You can't.
So I start about 1 hour after the procedure has started, because the first 1 hour is all about anesthesia.
Okay.
And then we start. So my job takes about 4-5 hours. And actually, when you're in it, you don't need a break.
So how many can you? How many surgeries humanly is it possible in a day? 2, like for one doctor, for you.
So
3?
I think I like to do 2 cases in a day, but there have been days where I've operated 4 cases in a day. And but
really?
Yes, but that's not how it works. It's not like 6 hours into 4.
Correct.
So I overlap my cases, because at that time I have I'll ask my team to stay more, and I'll have more help from the people.
I get it. So a few of the tasks would be delegated to somebody else.
So I can basically overlap the cases one after another.
But then still, isn't it not just physically, but mentally fatiguing as well? How do you manage it?
I think I enjoy it.
Nice. I think I think it's evident if one does not enjoy this, I think it's gonna lead to saturation way too early.
Yes.
Yeah.
And I try to keep my weekends off. So I do go to work on Saturdays, but I'll try to keep the day light. I will rather not keep any cases. I'll just do some patients in the OPD, my rounds, and then I should be home.
And what's your OPD like? How many patients in a day?
So it depends. I usually don't have a fixed hours of OPD. So what I do is I give them appointments as per my schedule when I'm free during the morning or the evening time. So at one time, 4-5 patients at least.
Okay. Let's jump into your health while doing all of this. How do you look at your health? What do you look at? What are your major pillars that you try to ensure that you take care of for your personal health? Because I've seen that a lot of doctors, we've been working with so many doctors, and we've noticed this, that the life of a doctor is very hectic. And I've seen doctors really complaining that we don't get time to look after our health while we are busy looking after other people, right? How do you take out time for your health? What are the major areas that you try to check box?
So a lot of credit goes to my wife. She looks after the diet part. I actually follow a balanced diet, and I try to take out about 3 days a week or 4 days a week, and I go to the gym and I'll work out for 30 to 40 minutes at least for 4 days a week.
There's a lot of questions that I have in my mind to ask you about diet, about training, about various supplements people have these days. But before we even get there, what's your take on the overall health status of our population, and what do you think are the major reasons behind where we are today? Like, we are the diabetic capital of the world, okay, and I think millions of deaths due to CVD, right? There are so many concerns that we are facing these days. What do you think? What's your opinion overall on this, and what do you think are the major causes?
So I think the major change we have seen is in the last 5 decades. So if you remember, our grandfathers, they never had these issues. Even if they had, it would be at the age of 75 and 80. Okay. Then came our parents. And if they had problems, it would be at the age of 50 and 60. And now we are looking at people who have problems at the age of 35 and 40. So a lot has changed during that period. I think it got worse. But now, since the last 5 years, people are more and more aware of their health.
It's changing. People are
It's
getting
changing
aware.
again. It's not going to get better right away. It's going to take a lot of time. But yes, there is awareness now. So even in the sense of, getting to the hospital or going to see a doctor, even if they have a slight problem, they are aware that they need to go and see a specialist. That's the major change, which was not there earlier.
People are I think, yes, there is definitely a tremendous rise in people focusing on preventive healthcare, I think, and I think that's something which only has to get better. More and more people have to try and see how best they can take preventive measures to keep themselves healthy. And having said that, now when we're talking about the generations, how in the last 5 decades you've seen people getting ill at different ages. I've seen a 25-year-old kid coming with a pre-diabetic or already diabetic, correct? What's the youngest age that you've, I don't know, would say operated or you've come across wherein needs attention, needs severe attention?
So personally, I've operated on a 29-year-old for a bypass surgery. And I've seen my cardiologist doing angioplasties in 25 years as well.
And this was not the case earlier? Or would be less?
It would be, unheard of. It must be an exception. But now these are not exceptions. They're like, at least you can have 1 or 2 cases a month.
And what are the major heart conditions that you see, which is very common these days in India?
You see, my cardiac surgery is a cold branch. Okay, so I'm the last person to see the patient. But let's talk about the cardiologists or the physicians who see the patient at
Earlier
stages. So what they see is a lot of people have come down with diabetes or hypertension. Now, eventually, they're going to present with atherosclerosis, where they'll have some blockages in the arteries. Let's say that they have blockages in the legs, okay? If they have that, that's called peripheral vascular disease. If they have the blockages in the heart, it's called coronary artery disease. And what I get a lot of patients with coronary artery disease. And apart from this, we have rheumatic heart disease, although the numbers have gone down over the years, but that's what we have seen, where the patient presents with a valvular problem at around their 4th decade of life.
And how do you, are there any ways where people without any diagnosis as such can try and identify these problems by themselves? Is there anything that you think they can?
So first thing is to not ignore the symptoms. So that's the first step. If I have a chest pain, I should not just ignore it, saying that, okay, it's
Gas
nothing.
issue,
It's nothing. It's a gas issue. or even my friend had it and there was nothing in that. So first step would be to not ignore it, to accept that there might be a problem, at least to go a specialist. If the specialist finds out there is no issue, at least you know now that you are okay. So I think that's the first step. The second step would be go for annual health checkups. We encourage everyone over the age of 35 and 40 to go for annual health checkups. It's important. You see, during these health checkups, you'll get a treadmill test or an echo, and you'll have some lipid profile, you'll have general blood test. We get to see the trend, the change in the last 2 annual checkups. These were the findings, and in this is the finding. So probably you are moving in the direction where you're going to have some problem in the future. Now, saying this, there are newer methods as well now, where actually it's like genetic testing, okay? Where if you go for that testing, they will tell you what problems you may have in the future. And what can you do from today to prevent that problem.
As my next question was just about, I was just about to ask you that, at what age? One is of course, the general complete holistic health checkup. Okay, that's one. And secondly, particularly with heart health, at what age you would say that irrespective a person is not seeing any sort of symptoms, but you would still say that, if you fall under this age bracket, you should go and get a routine test done.
Okay. So it's not a guideline, but it's my theory that what people should do. I think if you have a very strong family background of heart problems or atherosclerosis or hypertension and diabetes, I think you should start worrying at the age of 30 and 35. Okay? So you should go and get yourself tested, because every generation it's going to change. So like I said, our grandfathers, they had problem at 75, our parents at 60.
Correct.
And now the people are coming at 40. So it's going to change. So if you have a strong family background of these problems, then go for testing earlier.
Okay, and what would that test look like? What all would comprise in that
Let it
test?
be a normal health checkup and one consultation with any of the physicians.
So when you say normal health checkup, does the 2D echo, etc. also?
So what happens is these days you get packages from, for normal health checkups, even from a normal pathology labs.
Correct.
So what you should be doing is you should be doing the general blood test. You should have a lipid profile and HbA1c for if you're a diabetic, pre-diabetic, non-diabetic. You get your clinical findings there, where you can actually check the BP, the pulse, okay? And they also offer you one of the two things. So either it will be an echo or it will be a treadmill test.
Okay.
So that's your choice. People usually go for echo.
But one is sufficient?
I would say it depends on the patient.
Okay.
Like I said, if you have a very strong family background, so what you can do is, even without symptoms, go for echo 1 year, go for treadmill next year. At least in the 2 years, you'll have 2 findings.
Correct.
That's how it should be.
And also when it comes to the testing of the lipid profile, right? I see a lot of Western doctors, okay, so to say, who say that one should not limit testing only the general lipid testing, but should take a little step further and go a little more advanced lipid testing, where we get into testing the size and the number of particles of the LDL. Do you think required, not required? What's your take on that?
So first of all, we need to know what is advanced lipid testing. So basically, it's the measurement of the subpopulation of lipoproteins and apolipoproteins. So basically, we have 3 things: apolipoprotein A, A1, and B. B is good for us, A1 is not good for us. So let's say you have a patient whose HDL is good, LDL is raised, okay? That means that patient will have a higher level of A1. Now, if you go into advanced lipid testing and you see that the A1 levels are normal, even though LDL is high, in that case, you only have to target the LDL, okay? In some patients, you might see everything is normal, but he has strong family background of atherosclerosis, hyperlipidemia. You go for advanced testing. If you see the normal levels, that's good, okay? But if you see higher levels of apolipoprotein B, you know that he is doing well. He's going to do well.
Correct.
If you see more A1, you know that no, we have to start treating him as hyperlipidemic.
And again,
This is basically these testing help us to make sure that we give a targeted therapy.
so it makes sense. You would recommend
Yes,
that
yes.
we take this approach,
I don't recommend it on a daily basis.
not for a general population who's not seeing any symptom.
But I have selected patients for which I would definitely like to do all these
Like
testings.
who would that be for?
So patients, like I said, who have been chronic hyperlipidemic or have a strong family background. So in those patients, I will definitely like to
And
do
also when it comes to apolipoprotein, I think it is more of a genetic concern. It's not anything that a
Yes,
person
yes.
does by themselves, which
So hyperlipidemia in itself is a genetic problem.
correct.
So we can see this running down the generations. Now, is there any way to prevent that? I say, if I start today, maybe my kids or maybe my grandkids may have the benefit, okay, but not me.
And why is it that we are seeing more and more younger people facing health issues?
Well, there are a lot of things. First of all, the most important, I always attribute to two things. One is the pollution, which has increased since the last 5 decades. The second thing is our stress level. Now, like I said, I wake up 7 in the morning, I go to leave at work 8 in the morning, and I come by 9. Now, even after that, I'm usually on the phone.
Yeah.
We're getting calls from ICU or from the wards, from other patients who are at home discharged. So it never ends. And it might happen in the middle of the night as well.
And the stress is something, I was just speaking with one of the clients, okay? He's stressed, but he doesn't know why he's stressed. He's like, stress hai, but pata nahi kis cheez ka stress hai. Correct? On the other side, I met another client where I know that she's stressed, and she's stressed for something which can very easily be taken care of. Correct? So how would you... are there any ways, according to you, where one can manage these sort of stress?
So I do certain things. So till about 3 years back, till before COVID actually, I was very regular for snooker.
Oh.
So I used to go for about at least 45 minutes to 1 hour, and it really makes my day. Since COVID, I haven't been there.
But you've been regular with snooker?
Since 2004.
Wow, I have a client who's a snooker coach in UK.
Yeah. So I did that in UK as well. I played a lot in UK
Interesting.
till about COVID.
Just incidentally, last week, okay? So I used to love playing snooker long back, okay, during my college days. Just last week, I think after 8-10 years, I just felt like playing snooker. I called up my friend, and just last week, I think we should go once.
Definitely.
I'm just like a novice after 10 years, but I could play decently well. I think we should do that.
Definitely.
Next, after this, is the next time that we catch up should be for a snooker. So something that you can unwind.
Yes,
Right,
definitely.
for you, it's snooker.
We all need something like that. So now if I can't go to snooker, what should I do? So the options were to go to the walk, in the park, which I don't have time for. Then I never had tea in my life. I don't even know the taste of it. I don't drink coffee very often. It's like once in a month. Used to be once in a month. But now what I do is, there are certain consultants in the hospital. So I just, either they'll call me or I'll call them, and we'll just go and sit for 15-20 minutes at one place, sharing funny stories and having a coffee. So that's how I relieve my stress. And then at home, after reaching home, I do play games, online games.
Oh,
And-
alone or...
So it's a first-person shooting, and I love that. My daughter sits with me, and she tells me what to do. So that's how basically I try to do it. And for most people, if my patient is asking what should they do, I say at least 30 minutes of
meditation or walk?
walk with your friends. So one of my patient asked me, so whenever I try to go out for a walk, my wife says she'll come with me. So I actually discourage that part, because even when you're walking with your partner in the park, you'll still be talking about certain things that are happening at home in their life and everything.
Correct.
So basically, you're not letting go of those things.
That's interesting.
And so I always prefer my patients to go on a walk with the friends. You make your friends in the park as well.
Correct.
So you just have to go. That's how it should be.
Interesting. I very strongly believe, and there is enough evidence, and I very, very strongly ask all my clients, everyone that I come across, that walking is such an underrated form of exercise. And not just how it helps you physiologically with respect to the movement, but just the fact to de-stress yourself when you're out. But I used to tell people that go with your partners, if need be. But that's a very interesting fact that you've shared that, because with the partner, you will come up. There was a very interesting reel that I saw on Instagram, wherein the wife goes with the husband to the gym, and in the gym she's only talking about everything that's happening, and she's like, wow, this was so much fun. So she did not work out, she was only talking about all of that, and she's like, this was fun, kal se phir karenge. So I think now I get it, be it wherever. I think it's a good smart strategy to opt for what else apart from the pollution, stress, what else do you think is the
Eating
reason
habits.
why
Eating habits. So in my childhood, my father would ask me on a Sunday whether would you like to have some non-vegetarian food, and this would be like twice in a month. And yes, that was a very good day when we had non-vegetarian food at home. And then things have changed so much. Now what happens? Does our father ask us whether you want to have non-vegetarian food, or do we just go on Zomato and Swiggy and order the food?
Yeah.
So like I said, that eating habits have changed. So there was a discipline in our life earlier, and now we have lost that part. Apart from this, the number of times we are supposed to have certain things in our diet has changed. We're not bothered about having... So even with myself, there was a certain time where I would not eat any fruits, I'll not eat any salad, okay? But then I realized that this is not what I used to do. So I changed again. So I now have little bit of eggs, I'll have some salad, I'll have some fruit, I'll have everything, some vegetables. And I like it now. But people don't do that.
Yeah.
And I'm still spoiled. I feel that. So even after doing this, if I feel that, no, I'm not doing the right thing, you should understand what other people are doing.
Yeah, I think I can very, very well relate with you on this. And I tell people that knowing and doing are two completely different things, right?
Yeah.
I would know X, Y, Z about nutrition, but am I following that? And there are days wherein I know and I realize I do that quickly. Within days, I realize that in the past 3 days, my consumption of fruits and vegetables was not how much I would want to. Even water for that matter. I know that I'm supposed to drink X amount of water, but I just realized that the day was such that I did not end up drinking enough water. So I tell people that it's always best how best you can be cautious about what you're consuming. If you just leave it and try and take it more on the go, जो खा लिए वो खा लिए, आज खा लिए नहीं खा लिए, you will never really be able to have a good, proper, optimally nourished diet. I think I'm absolutely with you, and I can relate with that.
Even to some of my patients and also to my friends, I tell them that you don't have to look at the diet of one day.
Yeah.
So if you are trying to follow a fixed calorie diet, I would say you should consider, for example, if you want to take 2,000 calories in a day, kilocalories in a day, you consider 14,000 in a week. How you do it, it's up to you.
Correct.
Even if you're having 3,000 one day, then make sure that you have to adjust it the next day or in the whole week.
Yeah.
I think that's how we have to do, because it's not possible to follow the same thing every day.
Life is so different on different days. So I think that's the way, And once people understand that, I think it is only going to get easier for them to manage that. All days are not the same.
Yeah.
There are days wherein you have the bandwidth to be more focused. So try and take advantage of that, so that on days wherein you do not have that advantage, you spill over a little on the diet front, and that's how you manage. That's exactly how you mentioned, right? That if it's 14,000 calories a week, it's okay if on a day you're taking 3,000 and the other day you just try to compensate. So absolutely makes sense.
Things have to change over time. See, we have had bad habits now. हमारी eating habits इतनी अच्छी नहीं रही हैं. So how can I make sure that my daughter doesn't follow the same thing? Okay. So till date, she's 6 years old. She doesn't eat anything from outside. She only had home food. It's not because I asked her to. She doesn't like to eat from outside, and I encourage that.
So I think that's as parent, what I do is that I am very particular where all do I expose them. For everyone who's got kids, I think this is something which has really worked in my favor. Is that I never took them to KFC, McDonald's, burger. I just never took them. So they are just not exposed to that, and I've seen that they never come and ask me. So wherever I've exposed them, and if they've seen that now it's there, they know ye available hai, chalna hai karke. But in general, otherwise, I think as parents, what we do is what they're gonna observe. Batane se, I think it's not really gonna work.
Yeah. Now she tells me, Papa, junk food nahi khana hai.
Yeah. I remember once, it's good, So it's interesting that I asked my son that, do you know the definition of junk food? I've asked so many people, and a lot of people don't really know the definition of junk food, or rather what really falls under a junk food, okay? And I tell people that a burger and a pizza, you have the option to make it in such a way that it does not fall into a junk food. Junk food by definition is what? Anything which is supremely high in calories and absolutely low or no nutrition value, right? So a burger, if you really want to make out of a good whole grain bun and good protein sources and vegetables inside, it's a good whole meal. And same with pizza. If you've got a good wholesome base with nice protein sources topped with oregano vegetables, it's a good meal, right? I wouldn't put that into junk. Sure, it can go high in calories, but you can still manage. But it has good nutrition values with respect to the item that you've topped it with. But there are few items which is absolutely junk. And I asked my son, and he answered it saying that, something which is high in calories. I said, wow, I have never thought about what calories. But he's aware. He's just, I think, 8 years old now?
So
and what about?
So for me, the junk food is whatever we don't need, but we want it.
Yeah.
Basically, it's a habit of getting something, a fancy burger or a fancy pizza. Yeah. But do we really need that? No, we don't.